Thanks for watching 12 to Your Health. I'm Janine Strafasi. More than 30 million Americans suffer from a painful condition known as chronic sinusitis. Not only can it make it difficult to breathe through your nose, but it can also cause throbbing facial pain and headaches. There are options that can help patients, though, and here to discuss chronic sinusitis, Dr. Frank Sciascia of Riverside Plastic Surgery and Sinus Center, and Jeff Runke of Tinton Falls, a chronic sinusitis sufferer who recently underwent a new type of surgery to relieve his symptoms. Thanks for both of you being here at News 12 New Jersey.
Happy to be here.
Appreciate it. All right, Dr. Sciascia, let's talk with you first. What is chronic sinusitis?
Chronic sinusitis is basically an inflammation of the sinus mucosa that lines the cavities of the sinus walls.
How common is it?
Oh, it's very common. It's probably one of the more common chronic health ailments afflicting people in the United States right now. It's right up there with back pain and arthritis.
Well, Jeff, I'm dealing with bronchitis right now. I'm all stuffed up. I can't imagine. This is temporary. I can't imagine living with this day in and day out. What was that like? What was the quality of your life?
It was terrible. I would suffer from 4 to 5 sinus infections a year. So I was always constantly on antibiotics. Also headaches. I would get terrible headaches right above my eyes that would remind you of a migraine. And they would just pound all day long, very hard to concentrate. Very difficult way to go through life.
I bet. It's hard just doing your daily routine with that situation. So, doctor, what are some of the symptoms? He mentioned some of them. Let's talk about some of the symptoms that people should look out for, and how do you know it's different than your normal headache or cold?
Well, that's actually a very common dilemma that faces physicians when they're presented with a patient that comes in with some sort of upper respiratory tract infection. The big question, is it a sinus infection? Is it allergies? Or is it just a cold or flu? And a lot of these symptoms overlap. The 3 most common symptoms that are affiliated with sinusitis are, number 1, chronic pressure around the head and the face area, periorbital pressure, headaches. Number 2, postnasal drip, this constant feeling of drainage in the back of your throat or phlegm, and also nasal obstruction.
And Jeff, what was the thing that drove you to going to a doctor? Because I think a lot of people just live with this for a while and then say, oh, I've got to do something about this. What brought you there?
Yes, and I suffered. The headaches were the worst part of it. I would suffer. I went to many doctors dealing with migraines. They really couldn't do anything for me. None of the medicines worked. I had read an article about the sinuplasty, and then I had gone to Dr. Sciascia to look for some relief.
And this hit you as an adult only, or did you always have something like this?
No, when I got older in life, then it started to bother me, but it got progressively worse. So that instead of maybe 1 day a week, it was starting to turn into 3-4 days a week.
Gotcha. Dr. Sciascia, what's put someone at risk of getting chronic sinusitis?
Oh, there's a number of risk factors. Number 1 probably would be some sort of anatomical deformity in the nose, such as a septal deviation, a narrow nose. It could be congenital origins. Environmental factors definitely play a role, where you live, what you're exposed to at work, allergies, asthma.
All right, let's talk about treatments. There is help out there for people with chronic sinusitis. What would be the first line of defense for treating it?
Okay. First of all, you have to determine, are you dealing with sinusitis? Number 1, is it an acute sinusitis or is it a chronic sinusitis? Because each of those have different pathogens, different types of bacteria or even viruses or fungus that are involved. But usually the mainstay of treatment initially is medical, non-surgical, and we try aggressive medications, aggressive therapy with long-term antibiotics.
And is that what you went through, Jeff? You took antibiotics for a while, you said?
Yes, I did.
Okay.
And often we would get, the advantage of seeing an ear, nose, throat specialist is that we can look inside the patient's nose with a scope and actually see what the anatomical problem is, identify if there's any polyps, and see if there's pus. And if there's pus, we can actually culture it and grow out what type of bacteria is present, and then we can be very specific in the type of antibiotics we want to pick.
Gotcha.
And then also decongestants and steroid sprays are helpful.
Now, there is surgery available.
Of course.
There's traditional surgery, and then, Jeff, you went through something that's relatively new, the balloon sinuplasty.
Correct.
Doctor, first tell us about the typical surgery that's out there briefly. And we're going to look at some video while we do talk about the different surgeries.
Right. Well, by traditional surgery, I feel that you're probably referring to endoscopic sinus surgery, and that's been around since the mid-'80s. Do you want me to explain this video
sure.
right now?
What are we looking
What
at?
we're seeing now is a microscopic view of the lining of the sinus mucosa with the cilia, the hair cells that beat to keep everything moving. You always have a constant mucus blanket that's flowing through the nose that's necessary to have a healthy nose and sinus. Right now we're seeing swelling of this mucosa with obstruction of the drainage outflow tracts with a buildup of fluid. This would be an acute sinusitis condition. You can see how the mucosa is throbbing, simulating, I guess, what would be causing a headache. Now there's relief with drainage. Again, they're showing the swollen, thickened mucosa. Now they're showing the traditional techniques of using instruments under endoscopic control to open up that obstruction, open up that duct.
And this is
for
all
drainage.
done through the nose?
It's all done through the nose, through the nostrils. That's the beauty of the surgery. Now we're using a balloon sinuplasty technique. We're inserting a guide wire under fiber optic control.
And this is what you did to Jeff?
Right. Using the balloon now. The balloon is dilating. It's dilating, opening up that stenotic area and allowing the drainage to come through.
So you're draining it out,
Right.
and the drainage then becomes permanent?
Well,
or hoped?
Well, the opening hopefully becomes permanent.
Gotcha. Jeff, how did the surgery affect your life?
It was probably one of the best things I've ever done. I haven't had a headache since I had the surgery.
And when did you have the surgery?
In September.
Okay.
Yes.
And this has made all the difference for you. Do you still take medicine, though?
I don't.
No medicine?
No medicine.
No asthma medication, right? A lot less.
I haven't, yeah. I typically suffered from a slight case of asthma
Gotcha.
with inhalers, and my asthma has improved as well.
Allergies.
Dr. Scacia, who is a candidate for this new procedure that you're doing, balloon sinuplasty?
First of all, nobody's a candidate for surgery until they failed aggressive medical management. And basically somebody who's suffering. If you just had a sinus infection for the last week or two, you're not going to be undergoing surgery. But most of my patients that I see, I've already seen the primary medical doctor for years, been having sinus problems for many years, tried many different medications or even acupuncture or alternative therapies, and nothing's working. I usually would try another round of antibiotics just to make sure that we've exhausted that. And then we have to get a CAT scan. And if the CAT scan shows certain things, then they become a candidate either for the traditional or the balloon or a combination of the two.
Gotcha. So something to talk to your doctor about once you get to that point of being a candidate for this procedure. Well, thank you both for being here, and good luck with the future quality of life there, Jeff. We appreciate it. Our thanks to Dr. Frank Scacia and Jeff Runke. Now, if you have any questions or comments about today's interview, or if there's a topic you'd like to see discussed on our program, you can email your thoughts to us at 12toyourhealth@news12.com, and stay with us here on 12 to Your Health. When we come back, Dr. Derek De Silva will answer your email questions, but first, let's take a look at this week's community health calendar. Email questions. Let's take a look at this week's health calendar. On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
On 12 years, but first, there's a top community.
The CAT.
about 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.
About 12 years, but first there's a tuck community.
The cat.